Thanks for that, Margot. And I'm going to be co-presenting with Christine Eastman, who did the analysis of this, so she's going to answer all the difficult questions. I don't know, I don't want to give her I don't know much about her background, but she has worked at for FACS and the Melbourne University and the Social Policy Research Centre as well. So what we're going to discuss is to look at service provision and support for the child and for carer. We are focusing on three kinds of support: informal support, that's for carers; casework support, and for the children, services support, including health, counselling and childcare. And this paper is based on an analysis of only waves 1 and 2 of pathways. And just to flag up that some of the figures that Christine will present are slightly different from some of the other presentations, just because of the way that some of the variables have been derived as slightly different, but the overall picture is very similar. So the issue that we're really looking at is, other than the actual provision of care, service provision is the most important component of the care experience, supporting the child's well-being and outcomes. A very wide range of services are provided to children out of home care, as well as to their carers. And that includes health, education, counselling, physical services, childcare, etc. So there's a wide range of services provided to care. And there's a particular issue, caseworker support is a key component of the service provision for children. And caseworker support has various different influences on children's outcomes. Firstly, directly, the caseworker actually works directly with the children, sometimes supports the carer and accesses other services who then are able to support the child and carer. So casework support kind of works in a range of different ways. Sorry, going back. We did, like Paul, we did a literature review of this area, and what we found in the Australian and international research, firstly, there's very little research on services for children out of home care, but it confirms firstly that children have very high levels of needs for services, particularly in terms of their health, socio-emotional well-being and educational well-being. And just reflecting on some of the previous presentations, a lot of the research indicates the very high levels of difficulties that children in care face, and particularly when they leave care compared to the general population. And care's got a very bad reputation as being very poor for children. It's quite interesting to see some evidence that actually care can be beneficial to children rather than deficient for children, because I think the general view of care is that children actually do badly in care. But one of the factors that helps the children in care is that they do have greater access generally to services than children not in care. Children out of home care benefit from health and education plans and good partnership working between caseworkers, carers, and children and the relevant workers. So in an ideal world, they would have all these plans, and those plans would be put into action. There's no previous literature which relates children's needs to the provision of services, although research does indicate that many health and cognitive issues are not picked up for children who come into care. And there's very limited research on the impact of casework on children and carers in terms of their access to services or their outcomes. Just to flag up that because it's only 2 waves, we're not looking at outcomes here. So we're not looking at the impact of services on children's well-being. That requires at least 3 waves and maybe more. So what we're looking at really is about access to services. So I'm going to hand over to Christine, who will talk about our findings.
Thank you very much. So the next part of the presentation will be divided into 2 sections. The first relates to services used amongst children and young people in care, and the second is around the services and support used by their carers. I'll just quickly go over a couple of the details we need to understand in order to go through the next bit. What we did is slightly different to a couple of the other studies. We've selected children and young people that have completed 2 surveys. This slide basically shows that there's little difference in the demographic characteristics of the selection that we made in order to do our survey. And I'll just mention, both Paul and Merrin have gone over the next part of our slides, which is around our definition, and we basically made a proxy measure for the need for services because we decided that any kind of analysis of service use needs to be contextualised in terms of need. There's not really much point in talking about a group of people using services that don't need them. So what we had to do was try and figure out how to link need to use, and the Pathways survey enabled us to use a lot of the measures that we've previously talked about here today. And what we did was basically combine them together to make a bit of a basic indicator of need. So I'm not going to go over the results of those because in fact they're similar to the studies you've seen today. But what we've basically done is counted the number of issues related to socio-emotional development, cognitive issues, physical development issues, long-term health conditions that were reported by the carer, and we've then combined them to form a basic indicator. So it's quite a different approach to using the data compared to the previous studies that have been spoken about today, but we kind of needed something in order to look at service use. I'm just going to skip through this in the interest of time, basically, but what we're showing here is what we found when joining those together. If you look at the bottom row, amongst all ages, we're looking at a high proportion of children and young people with 2 or more of those issues or needs. And so 48%, almost half of the children in the survey had at least 2 of those. And that could be carer reported or it could be any of the developmental measures that we've spoken about before. Another 30% had 1 of those things, and 22% had no issues or needs, and that's at wave 1. This slide just basically shows the change over time, which we've already discussed today at length, so I'm not going to stay on this for very long, apart from to say that our joint measure seemed to indicate that children reduced in the amount of kind of need for services over time. We've already gone over this in terms of the carer rating of the child's general health. So what we did here, is slightly different again, is basically look at the carer rating, which is between 1 to 6, and looked at whether or not it's just changed over time. So you can see that the majority, just over half of the respondents indicated no change, but if you have a look at the 12 to 17-year-olds, which is the second row from the bottom, just a bit more than a third of them deteriorated in the carer rating of their health. What we need to be kind of mindful of here is that it's the number of children in that, or young people in that age group was only fairly small because by wave 2, a lot of them had exited care. So we've got a small group of people, but it does look as if they're not improving as well as the other children in care. This is kind of where we start the analysis of the services themselves. So what we're looking at here is the wave 1 and 2 service use itself amongst all children and young people in care. What we can see is, not accounting for age, there's quite high service use amongst kids attending GPs, paediatricians, dentists, and there's lower, as expected, use of early childhood health centres, and that's because this is across all children and young people and not just amongst those kids that are in that age group. And so a lot of this does have to do with child and young person age, as well as needs. So what we've done is a range of kind of multivariate regression analyses where we've accounted for both age, cultural background, and the type of service that they may have used, and placement type, of course. Thanks, Alan. So, yeah, there's quite a lot of, I would suggest that we're finding quite a lot of service use once we account for need, which I think is a fairly positive result for this group of kids. The next group of analyses we've done is related to carers. So what we've done in this particular group of analyses is just looked at individual carers. Because carers can be looking after more than one child or young person, we've just taken we've only analysed one carer at a time. Again, this is just showing that there's not a substantial difference between... this is just showing that the demographic breakdown of the carers that we've analysed in this, and it is basically carers that have responded to 2 surveys. So what this shows here is the satisfaction with their caseworker and associated agencies across wave 1 and 2. So carers were asked a range of questions related to their interaction with their caseworkers and other support agencies for their children and young people in care. And we basically made a measure out of that. And the top box relates to carers, relative or kinship carers, and the bottom relates to foster carers. On the left-hand side, we're looking at lower satisfaction, and on the right-hand side, we're looking at higher satisfaction rates. And what we can see here is that foster carers are indicating that they're slightly more satisfied with their interactions with the carers, the caseworkers and associated agencies, and that's across both waves of the survey. You can see here, I just should point out, the 3 items at the top are what we've combined. So ability to reach the caseworker when needed, assistance from the caseworkers, and the working relationship with other agencies related to the child. What we're now looking at is the contact that the carers have with their caseworkers across both waves 1 and 2. So while we've followed these carers, we've basically averaged out the contact that they've had or the responses to their contact across both ways of the survey. What you can see is quite a large difference in terms of fostering relative kinship carers in terms of the frequency of contact with their caseworker, particularly when we're looking at those responding less than monthly. So relative and kinship carers are telling us that they have contact with their caseworker less than monthly, whereas foster carers tend to have more frequent contact with their caseworker. The next slide is about the informal support that is accessed or has been accessed by the carer across wave 1 and 2. What we can see here, we've got a range of informal supports ranging from family members, in which most of the carers kind of reported access. There's some substantial differences when we're talking about friends, their own parents, other carers and their spouses' parents, in which foster carers reported more contact and kinship carers, relative kinship carers, reported less or less support. This is basically just tallying up the average number of informal support types across both waves, that just again to kind of reiterate the differences in the amount of informal support access by carers. It's basically a different way of showing the previous slide. We've got relative and kinship carers reporting fewer numbers of informal support types across both waves compared to kinship carers. This slide talks about professional services and support, accessed again across both waves. We can continue seeing quite large differences between foster carers and relative kinship carers, particularly when we're looking at carer support organisations and groups, in which relative and kinship carers reported less support being accessed. Also with respite care, and we're looking at more, relative and kinship carers accessing more childcare or before and after school care. So I should note here that this doesn't account for the type of care, it doesn't account for the age of the child. So this is just a straight descriptive view of the differences between these two groups. But the regression results that we've done that did account for some of these things did continue to show differences between the supports used by carers in that kinship carers do tend to have less or report having less support compared to foster carers. Again, this is just the number of professional support services used by carers across waves 1 and 2, reiterating the lower use of professional services and support amongst kinship carer, relative and kinship carers. And this slide relates to the carers were asked what they would like to have received but weren't able to when their child was placed or when the study children were placed. This is just a report of wave 1, given that this is when the children entered care. It's quite interesting in that there are, begin to be quite large differences again in terms of the type of care that's being provided. Again, there's different kind of degrees of, or different types of caring again within the relative and kinship care that we're not accounting for here. But what we can see are that quite a lot or almost all relative and kinship carers reported that they would like to have received carer allowance payment and didn't when their study children were being placed or were placed. There's a large difference for time and advice from caseworker and manager, in that just over 60% of relative and kinship carers reported that they would have liked to have received that support when their study children were placed, but they did not receive that support. And access to carer support groups, there were quite a large difference as well, in that just over 40% of relative and kinship carers reported that they would have liked to receive that type of support when the children were placed, and they didn't. So I think it's quite interesting to see these differences, and what I would like to do from here is basically go a bit further into the detail of these things to see whether it's got something to do with the type of care that's being offered, in which the children were placed, whether there are any other demographic differences. We did do some preliminary analysis for carer age, the placement type obviously, the cultural background, the number of study children they had, and the need of the child, and there still was quite a large difference in terms of kinship carers reporting kind of lower or higher need for services or higher responses to needs for services, and lower amount of support, whether informal or formal support. So I think from here on we actually kind of disentangle that a little bit more and look further over time at the wave 3 data to see whether any of these things have changed. Say for example, we might be looking at placement stability to see whether that has an influence from here. Thank you very much. That's it.
Back over to me. So in summary, just to say one thing before I summarise about the actual questionnaire in terms of services, the question just asks whether the child has access to particular service. So we don't have, because I'm preempting questions about the amount of service they've received or the quality of services. It's just, have they received that service over a particular period in time, which is a limitation in the survey, but it's very difficult to ask people to recall over the past year how many times you've received X or Y service. But just to summarize, children in the cohort had high levels of issues in physical, social, emotional, and cognitive domains, as we showed. Youngest and oldest group showed more issues, so the middle age group, if you remember the slide, had fewer needs than the youngest and the oldest. The oldest in particular had more needs. The well-being of most children in the cohort improved between the two waves, although some did deteriorate, and again, particularly in the older cohort. Generally, those who had higher numbers of issues and needs were able to access more services. So, as Christine said, that's a positive finding. And service use stayed the same or decreased between the two waves for all services except dentists, and this is likely to be driven by the age of the cohort. So as children get older, obviously they use services slightly differently, but it certainly didn't drop off significantly as children were in care. Kinship carers have less access to caseworkers and are less satisfied with their contact than foster carers. They don't access as much formal support from agencies or informal support. So one of the hypotheses might be that kinship carers might substitute their lack of access to formal support by having more informal support, but as Christine showed, we found that the opposite is the case. So they neither have formal support nor do they have informal support. Another myth is that kinship carers don't have formal support because they don't want it. And again, our findings show that actually they did want the support from carers, from caseworkers, but didn't receive it. So it's not that the kinship carers refused support, it's that they, for whatever reason, what we don't know is the reason, but for whatever reason they didn't receive the support that they would have liked. Interestingly, children in kinship care seem to have equivalent access to services compared to those in foster care. So one of the issues Christine didn't report on in the regression analysis, there was no difference in access to services from the child point of view in terms of the type of care that they were in. So although kinship carers themselves have much lower access to services, the children in their care have similar levels of access to services compared to foster care. So that's it, thank you. And like the others, I'd like to acknowledge everybody else that's been involved in the study, without whom we couldn't have achieved what we have.
Okay, and